We've been reporting this week on a record high number of strep infections across Canada. Health officials in British Columbia now say 4 children have died in the last month of the invasive Strep A. The CBC's Linda Ward has the details.
2 more children have died since mid-December. Now that brings to 4 the total number of children who have died in that time frame. This from invasive Strep A infection. Now, when we talk about strep, we often will think about strep throat, a fairly benign condition that can be treated with antibiotics, but we're not talking about that here. We're talking about invasive strep, which is very dangerous. It happens when that bacteria gets into the bloodstream, gets into the tissue, gets into the lungs, causes pneumonia, can cause flesh-eating disease, even toxic shock syndrome. It mainly affects older adults, children, and people who have underlying health conditions. Now, there has been an increase over the past year or so, and we're going to show you now just what that increase looks like. You can see on this chart here a real spike in 2023 of infections. 4,600 cases of invasive strep last year. That's a 40% jump from 2019. And when we take a look across the country, we'll start with BC here. 60 cases reported in people under the age of 20 last year. That's 3 times as many reported in this age group in 2022. When we talk about Ontario, 48 people have died. That's including 6 children since October. And in New Brunswick, 10 people died last year, and they're already reporting 2 more deaths just in the last month. Now, we are hearing from Public Health Ontario about some of the reasons why they believe this may be happening. Here's more on that.
It appears that there are really multiple different strains responsible for this increase. There isn't a single strain that could explain fully the trend we're seeing. However, we are looking at differentiating the strains for each invasive case that does occur and continuing to track that quite closely and to try to see what patterns are emerging in other countries as well.
Now, Andrew, we also know that Strep A tends to go hand in hand with other respiratory infections, things like influenza. And we're hearing from the BC Centre for Disease Control that in the cases of these 4 latest deaths among children, that they were also suffering from a respiratory illness at the time.
And Linda, how can you tell if you need to seek treatment?
Yeah, it can be very tricky to determine, especially at this time of the year. We've got so many respiratory infections going around. Sore throats are pretty commonplace when you need to see a doctor. We've got a bit of a chart here for you, what's what. When you're looking at strep versus viral illnesses, you're looking for a sudden onset of symptoms, severe sore throats, difficulty swallowing, swollen tonsils, even pus at the back of the throat, white spots on the tongue, swollen lymph nodes, a fever that's persistent. We're not talking about things like runny nose and coughs. When you have strep, you need to go to a doctor because you need to get antibiotics right away. And certainly when it comes to invasive strep, they say the earlier that you can get these antibiotics into your system, the better. Andrew.
The CBC's Linda Ward.